One day, a 26-year-old man named Bob suddenly began feeling very anxious and ran out of his parents' house, where he approached a nearby woman innocently walking her dog and politely offered to take over. When this offer was rejected, Bob attacked her and began tearing at her clothing. He was quickly restrained without resistance, and he began saying that he had done to Satan what God had wanted him to do. This sounds like a pretty open and shut case, right? Well, as with most facets of life, it just isn't that simple. We'll return to Bob's case later, but for now, let's learn a bit about psychosis. Psycho is a term that is thrown around all the time, especially in the context of erratic, violent, and criminal behavior. We all love an overproduced Netflix series about our favorite deranged psycho killers, the likes of Jeffrey Dahmer, Ted Bundy, John Wayne Gacy, and Charles Manson. With the attention placed on these individuals, they become the most available link between mental health and crime. So when someone is labelled with the term psychotic, especially in the context of criminal offending, the mind is directed to the aforementioned individuals who are not psychotic, rather psychopathic. Despite the closeness in naming, the two disorders are distinct in nature. Psychopathy is a neuropsychiatric disorder that encompasses social and interpersonal abnormalities involving a lack of empathy, poor behavioural controls, and antisocial tendencies. Psychosis is a collection of cognitive symptoms that influence the mind, causing a loss of contact with reality. During a psychotic episode, a person's thoughts and perceptions are disrupted, and they may have difficulty recognizing what is real and what is not. The official diagnostic criteria in the DSM-5 for the schizophrenia spectrum and other psychotic disorders are abnormalities in one or more of the following 5 domains: delusions, hallucinations, disorganized thinking, disorganized or abnormal motor behavior, and negative symptoms. Lastly, mental health in the context of law typically means severe emotional or thought disturbances that negatively affect an individual's health and safety. Before moving forward, I will mention that while people diagnosed with psychosis can be dangerous, so can anyone else, and it's important to recognize that psychotic individuals can be treated and reintegrated into society. Stigmas around mental health and psychosis are shown to have a direct negative impact on recovery, so keep in mind that behind the statistics there are real people facing real issues. Facts. People who are diagnosed with a psychotic disorder are shown to be significantly more likely to engage in violent behavior. Psychosis is an illness comprised of many affective, antisocial, lifestyle, perceptive, and delusional symptoms that are likely to be directly involved in criminal offending, as seen in Bob's perceived fight with Satan in the street. People with psychosis tend to have far higher rates of interpersonal violence and homicide than the general population. Sex crimes are uncommon among psychotic offenders, and interestingly, it is uncommon for them to target people whom they don't already know. A meta-analysis was conducted examining studies on the risk of criminal offending, comparing individuals with a psychotic illness versus the general population, involving over 15,000 people with psychosis and over 186,000 controls. Results from the analysis found that 1 in 5 psychotic individuals committed crimes causing engagement with the criminal justice system, making them more than twice as likely to offend when compared with the general population. There was no significant difference in statistics between men and women, and this high rate of offending was shown to extend across all offence types. These statistics are shown in the United States, where there are approximately 2 million annual bookings of people with severe mental illness into jails, emphasising the disproportionate representation of the mentally ill in the criminal justice system. A 2007 study conducted on the reoffending rates of serious non-lethal violent offenders in Australia found that offenders with psychotic illness or cognitive disorder had a higher likelihood of returning to custody compared with released forensic patients. The study also noted that offenders with schizophrenia had an even higher rate of reoffending and violent reoffending. Now, with some groundwork in place, we can move back to Bob. 6 months before the attack, Bob began experiencing seizures, where he became very confused, lethargic, and disorientated. Bob's seizures started becoming increasingly common, and the severity of the situation worsened. He was suffering from major distress with the long confusional periods that followed his seizures that typically lasted from 1 to 4 days. He was having feelings of depersonalization and visual disturbances, where he had distorted perceptions of the size of objects and sometimes viewed them as two-dimensional. His friends and family described changes in his personality, noting his unusual affective states, decreased attentiveness, altering depressive and manic states, and general neuroticism. all symptoms highly indicative of psychosis. 3 days before the offence, he had a severe seizure, and on the day before the event, he began acting very strangely. Upon analysis of Bob's case, the psychologist determined that on the day of the attack, Bob had suffered from a psychotic episode that occurred in association with his history of epileptic seizures. Finding that he met the criteria for epileptic psychosis, they recommended to the court that Bob be adjudicated by reason of insanity. To Bob, he was not attacking a woman in the street. He was following God's will and fighting Satan. Often with crimes the likes of Bob's, there is a public outcry for justice with the simple idea that a crime has been committed, so the individual should be detained and removed from society, as with any other case. With an explanation of the bigger picture surrounding Bob's case, the reasons behind the crime become a lot clearer, as we see that Bob, while having committed the crime, was not criminally responsible. Bob's case, like many others, was entirely preventable. One of the main reasons why psychotic individuals have such high offending rates is because the disorder is often not adequately treated until the crime or psychotic episode is inevitably carried out and someone gets hurt. Even after the offence, reoffending rates show that psychotic offenders are still often not provided with adequate treatment and rehabilitation, instead being reintegrated into society without their mental health being properly addressed. This does pose the question, if we are aware of the rates of offending seen in individuals with psychosis, why are preventative measures not enforced to target the disorder at its early stages? Prevention of these behaviours means early intervention and treatment. The information that we have on psychosis provides a target for rehabilitation and prevention of future offending. With this in mind, maybe one day society will have the capacity and will to accommodate individuals suffering from mental illness to live happy and fulfilling lives. Thank you for listening.